Today, let's talk about how brain fog and other cognitive changes can happen in menopausal women and what can we do about it. In my last video, I spoke about brain fog and what are some main conditions which are associated with brain fog. We spoke about post-COVID brain fog and the latest research done by two Yale neuroscientists on the use of two medicines, guanfacine and N-acetylcysteine, on the brain fog of long-haul COVID patients. Today, let's talk about how brain fog and other cognitive changes can happen in menopausal women and what can we do about it. Well, welcome to this channel. For those of you who don't know me, my name is Dr. Najmun Riyaz. I am a practicing psychiatrist in the state of New Jersey, a certified empowerment coach, and I also love to make videos on our emotional and mental well-being. If you're a woman who is going through menopause, then you probably know what I'm talking about. Now, menopause is a very challenging time for most of the women. Now, if you're one of those lucky women who may be blessed with some good genes, then this time might pass very smoothly for you. But for most of us, this time of our life brings with itself a wide variety of physical and emotional symptoms. And some of these symptoms can take a huge toll on our physical and mental well-being. A woman can go through physical symptoms like feeling tired, fatigued, night sweats, insomnia, hot flashes, vaginal dryness, and painful sexual activity. Now, this can all be very bothersome and can take a huge emotional toll on a woman's well-being. It can be huge if you are a working woman, if your life is already stressful, or if you're going through a difficult relationship or even a financial stressor. Some of the emotional symptoms, which are very commonly seen in perimenopausal or postmenopausal women, are mood changes like irritability, sadness, lack of motivation, aggressiveness, problems focusing, fatigue, difficulty concentrating, and even anxiety and depression. Now, some women who are already struggling with a depressive disorder, bipolar disorder, or schizophrenia might also see worsening of symptoms or even a relapse of their illness. What causes these changes in our body as we hit this period of menopause? As many of you must be knowing that women's ovaries secrete a hormone called estrogen. Now, this estrogen is not only important for fertility and the reproductive health of a woman, but it's also very crucial for us women to maintain our vigor and our normal emotional and physical growth. Now, Dr. Lisa Mosconi, through her research, found that estrogen is believed to push neurons, which is the brain cells, to burn more glucose so that they can make energy, and which is what keeps our brains younger and healthier. As estrogen declines with age, our neurons start slowing down and they age faster. And this is why we get these cognitive changes like trouble focusing, concentrating, increased forgetfulness, and even depression and anxiety, or other menopausal related symptoms, including hot flashes, insomnia. Now, women have difficulty remembering names of people, difficulty remembering the right word, and even conversations. And research shows that menopausal symptoms can adversely affect the work production and the work satisfaction. Now, I have seen many women who face these cognitive changes. They feel like as if they're going through some form of a dementia. We can't concentrate, multitasking becomes almost impossible. Well, it wasn't good for us to begin with. Now, there was a study which was published by Dr. Lisa Mosconi, and in that study, she scanned the brains of 160 women between the ages of 40 and 65. And these women were going through various stages of perimenopause or postmenopausal transition. Now, the scans showed a decrease in both gray and the white matter, and also increase in the deposits of Alzheimer's associated protein amyloid beta, and a decrease in the glucose. So this basically explains some of these cognitive and memory changes that were taking place in the brains of these women. because these symptoms of menopause resemble early onset Alzheimer's, Dr. Mosconi recommended that providers should reassure women that this is not dementia, and it is basically related to low estrogen. And dementia usually happens in people who are over age 65, and very rarely will someone who has genetic tendency or a family history of early onset dementia show signs of dementia before age 65. So what will happen if women do not address these symptoms and do not actively seek treatment? Well, fortunately, even if we don't address these symptoms or we don't seek treatment, we don't go to our doctors, the studies are showing that during the first year of the menopause, the brain is at its worst, but memory and learning ability generally rebound to normal after the process of menopause is complete. So for some, it could take as little as 1 to 2 years, but for a good percentage of women, it might even take more than 5 years, and there are some studies which show that it may take longer than 10 years. So the question is, what can we women do to help eliminate some of these symptoms? And I mean both physical and these emotional symptoms of menopause. So there are some studies that have shown the benefits of hormone replacement therapy, and some people say that they may help, at least for these women, to regain their vigor, but a lot of them have failed to show that hormone replacement therapy can reverse the changes of menopause. But there are still ongoing studies in many peri- and postmenopausal women. Now, menopausal hormone therapy, or commonly known as HRT, is very helpful in alleviating the physical symptoms of menopause like fatigue, mood swings, hot flashes, vaginal dryness. There are generally 2 kinds of hormone therapies which providers use. There is systemic, which means, like in the form of a tablet, and then there is a low-dose vaginal products. Hormone therapy could be either just estrogen, or it could be combined estrogen and progesterone. It's your doctor who will actually determine whether or not you're a good candidate for hormone replacement therapy and whether the benefits of using HRT are more than the risks. Because remember, not all women can tolerate them. Hormone replacement therapy has some serious side effects, for example, blood clots, high blood pressure, and even a risk of a stroke. There is some data and research which shows some herbal and other plant-based treatments or supplements, or what we call mind-body therapies or alternative medicine, can be used in some women. However, again, it's very important to remember to talk to your providers, because some of them may have some serious side effects, even though that they're labeled as natural. So it's important that you talk to your provider before you use any one of them, because they can interfere with some of the other medications that you're using. So some providers may use non-hormone medications, for example, gabapentin or serotonin reuptake inhibitors, commonly known as antidepressants, or there are some estrogen-like medications like tamoxifen and raloxifene. There are also some reports which show the benefits of using ginkgo biloba in improving memory. But again, this is something you may want to check with your provider before you start these supplements. There was a study done around 2021 at the University of Pennsylvania that indicated that medications which are used for ADHD can be helpful for women during menopause to retain some of the mental faculties. In this study, they used a drug called lisdexamfetamine, also commonly known as Vyvanse, which is used for ADHD, and the study showed that at least 40% of women showed improvement in symptoms of cognitive decline, as opposed to 17% of women who were given a placebo. So there is some role of stimulants or non-stimulants used in ADHD, but again, that's something you will have to discuss with your provider. These medications have side effects. It all depends on how severe your symptoms are and what is the risk versus the benefit ratio. In the meantime, we can also count on those safe and natural and proven ways to gain our bodies in our ability to recover and rejuvenate from something as huge as a menopause. So first and foremost is focusing on your diet. Avoiding junk food, foods which are high in sugar content, simple carbs, and consuming foods which are rich in complex carbs or high in protein, a Mediterranean diet with lots of fruits and vegetables, consuming olive oil or fish can be extremely beneficial for retaining those cognitive abilities and also decreasing the intensity of the brain fog. Then hydration means drinking at least about 8 to 9 glasses of water daily, exercising for at least about 15 to 20 minutes, 4 to 5 times a week, utilizing over-the-counter supplements like vitamin B complex, vitamin D, vitamin C, omega-3 fatty acids, and there is another supplement which I mentioned in my last video, and acetylcysteine, which has also been found to be quite effective in maintaining this healthy brain function. It's important for a menopausal woman to decrease her level of stress. How? By again joining the gym, doing some yoga, journaling, or talking to a therapist, incorporating a 10-minute meditation in your daily routine, being mindful of your day-to-day activities, showing gratitude for little things that you've been blessed with. Try to establish a healthy social connection during this time, like talking to a caring friend, a family who listens in a non-judgmental way is a great way of improving your level of alertness, decreasing depression, loneliness, staying focused and relaxed. Try to develop some hobbies like gardening, taking up a new sport, or playing a new instrument. That also can be extremely helpful. Make sure you maintain a proper control of your blood pressure, maintaining a low salt diet, taking your medicine on time if you've been diagnosed with high blood pressure and are prescribed medications, and also maintain a healthy cholesterol level. Check your cholesterol levels frequently, and most importantly, ensure that you get a good night's sleep by maintaining a proper sleep hygiene, limiting your screen time, listening to a meditation tape at bedtime. I have attached a link to all of the articles that I consulted while making this video, so you can check those out. And there's also a link to a website which you might find very helpful. It's called the North American Menopause Society. There's a lot of helpful information for women out there going through menopause. There's a series of videos, helpful articles, a list of books, and even a list of local practitioners in your area who are trained in handling the menopause-related symptoms in women. So you may want to check that out. So as they say, like anything in life, this too shall pass. Focus on self-care during this period of the time until this time passes and we can settle in the next stage of our life. Please don't forget to subscribe to this channel to receive some more helpful videos on your emotional and mental well-being. So long.